Good evening. I'm Dr. Amelia Rose, board-certified cardiologist and specialist in nutritional health. Today I want to talk to you about something that has been used in traditional medicine for thousands of years. Something simple, affordable, and likely already sitting in your kitchen. That is ginger. Now, most people think of ginger as just a spice, something you add to tea or to flavor your food. But what many people don't realize is this. Ginger is a powerful bioactive food that directly influences your metabolism, your inflammation levels, your digestion, and even your cardiovascular health. So today, I'm going to walk you through exactly what ginger does inside your body, how it works, what the science says, and how you can use it safely and effectively in your daily life. Let's begin. Before we talk about its effects, I want you to understand what ginger actually is. Ginger is a root, technically a rhizome, of the plant Zingiber officinale. It has been used for centuries in both Ayurvedic and traditional Chinese medicine. What makes ginger so powerful are its bioactive compounds, particularly one called gingerol. Gingerol is responsible for ginger's distinct flavor, its anti-inflammatory properties, and its antioxidant effects. When ginger is dried or cooked, gingerol converts into other beneficial compounds like shogols and zingerone, which also have therapeutic effects. So when you consume ginger, you're not just eating a flavor, you're introducing active compounds that interact with your body at a cellular level. Let's start with one of the most important effects: inflammation. Chronic low-grade inflammation is at the root of many modern diseases: heart disease, diabetes, obesity, arthritis. Ginger acts as a natural anti-inflammatory agent. It works by inhibiting certain pathways in your body that produce inflammatory chemicals, specifically prostaglandins and cytokines. In simpler terms, ginger helps calm the internal fire that damages your cells and tissues over time. Clinical studies have shown that people who regularly consume ginger experience reduced markers of inflammation in their blood. This is especially beneficial for joint pain, muscle soreness, and chronic inflammatory conditions. Now let's talk about digestion, because this is where ginger truly shines. Ginger has been used for centuries to treat nausea, indigestion, bloating, and modern science supports this. Ginger helps accelerate gastric emptying, which means it helps your stomach move food into your intestines more efficiently. This reduces bloating, discomfort, and that heavy feeling after meals. It also stimulates digestive enzymes, improving how your body breaks down and absorbs nutrients. This is why ginger is often recommended for motion sickness, morning sickness during pregnancy, and chemotherapy-related nausea. Now, let's move into metabolism, one of the most exciting areas of ginger research. Metabolism refers to how your body converts food into energy. Ginger has been shown to have a thermogenic effect, meaning it slightly increases your body's heat production. This can lead to increased calorie burning, improved fat oxidation, better energy utilization. Some studies suggest that ginger may also help regulate blood sugar levels, which is critical for metabolic health. Stable blood sugar means fewer energy crashes, reduced cravings, and lower risk of type 2 diabetes. In addition, ginger may improve insulin sensitivity, allowing your cells to use glucose more effectively. As a cardiologist, this is particularly important to me. Ginger has several benefits for cardiovascular health. It may help lower LDL cholesterol, reduce triglycerides, improve circulation. It also has mild blood thinning properties, which can help prevent clot formation. Additionally, by reducing inflammation and oxidative stress, ginger supports the health of your blood vessels. This means better blood flow, lower blood pressure, and reduced strain on the heart. Your body is constantly exposed to oxidative stress from pollution, processed foods, and even normal metabolism. This stress produces free radicals, which damage cells. Ginger is rich in antioxidants that help neutralize these free radicals. This protects your cells, your DNA, and your organs. Over time, this can slow down aging and reduce the risk of chronic disease. Many people are interested in ginger for weight loss, and while it's not a magic solution, it can be helpful. Ginger may increase satiety or feeling full, reduce appetite, improve fat metabolism. It also helps reduce inflammation, which is often linked to obesity. When combined with a healthy diet and exercise, ginger can support sustainable weight management. Now, let's make this practical. You don't need large amounts to benefit from ginger. Simple ways to include it are fresh ginger tea, adding grated ginger to meals, smoothies, soups, and stir-fries. A general guideline is about 1 to 3 grams per day. Ginger is generally safe for most people. However, high doses may cause mild digestive discomfort. It can interact with blood-thinning medications, and pregnant individuals should consult a doctor before high intake. Always use it as part of a balanced diet, not as a replacement for medical treatment. I want to leave you with this. Sometimes the most powerful tools for your health are not complex or expensive. They are simple, natural, accessible. Ginger is one of those tools. It supports your metabolism, it protects your heart, it improves your digestion, and it helps reduce the inflammation that drives so many diseases. You don't need to change everything overnight, but you can start with one small step. Add ginger to your routine. Stay consistent, and let those small changes build into something meaningful over time. I'm Dr. Amelia Rose. Thank you for being here, and I'll see you in the next session.